Your first gynecologist visit, a complete guide to feeling prepared and confident. Navigating your first gyno visit, from nerves to empowerment. Taking the step to schedule your first gynecologist appointment is a major milestone in taking charge of your health. It's completely normal to feel a mix of emotions, curiosity, anxiety, and maybe a little awkwardness. But knowledge is power. Understanding what to expect can transform this experience from daunting to empowering. The American College of Obstetricians and Gynecologists, ACOG, recommends a first visit between the ages of 13 and 15, but many people wait until they become sexually active or experience a specific concern. Regardless of when you go, being prepared is the key to a positive and productive visit. This guide will walk you through everything you need to know, from scheduling your appointment to the final questions you'll ask your doctor. Let's demystify the process together. Why is a gyno visit important? A gynecologist is a specialist in female reproductive health. Regular visits are crucial for preventative care. Screenings like pap smears can detect precancerous cells early. Health education, get accurate information about your body, periods, birth control, and STIs. Problem solving, address issues like painful periods, unusual discharge, or fertility concerns. Building a relationship, establishing care with a doctor you trust is invaluable for your long-term health. Part 1. Preparing for your appointment. A little prep work can go a long way in making your visit smooth and stress-free. Here's how to get ready. Scheduling and timing your visit. When you call to make your appointment, you'll likely be asked the first day of your last menstrual period, LMP. It's helpful to track your cycle using an app or a calendar. Ideally, you should try to schedule your appointment for a time when you are not on your period. Active bleeding can sometimes interfere with the accuracy of certain tests, like a pap smear, and can make it harder for the doctor to perform a thorough visual exam. What if my period comes unexpectedly? Don't panic. Give the doctor's office a call. Depending on the reason for your visit, they may still want you to come in or might suggest rescheduling. It's always best to check. Pre-appointment hygiene. Keep it simple. It's natural to want to be clean for your exam, but it's important not to overdo it. For at least 24-48 hours before your appointment, you should avoid douching. Douching disrupts the natural balance of bacteria in the vagina, which can mask symptoms of an infection or irritation and lead to inaccurate test results. Your vagina is self-cleaning. Vaginal creams, powders, or medications. Unless specifically instructed by a doctor, avoid using any internal products as they can also interfere with test results. Sexual intercourse. Some doctors recommend avoiding intercourse for a day or two before a pap smear, as it can sometimes cause inflammation that might affect the results. You can ask the office for their specific recommendation when you schedule. A simple shower or bath with mild, unscented soap and water on the external area, the vulva, is all you need. Compile your questions. Don't be shy. Appointments can feel rushed, and it's easy to forget what you wanted to ask when you're nervous. Make a list of your questions and concerns ahead of time. Writing them down in your phone or a small notebook ensures you won't leave with unanswered worries. Remember, your gynecologist has heard it all before. There are no stupid or embarrassing questions. Sample questions to ask your gynecologist. Is my period normal? Regarding flow, length, pain. What are my birth control options? Is this vaginal discharge normal? How can I perform a self-breast exam? Should I be tested for STIs? What is the HPV vaccine? Do I need it? Why do I have pain during sex? Are my mood swings related to my cycle? How can I manage period cramps? When should I get my first pap smear? Part 2. What to expect. During the visit. Okay, you've arrived. From the waiting room to the exam room, here's a step-by-step breakdown of a typical first visit. Step 1. The paperwork and vitals. You'll start by filling out forms about your personal and family medical history. A nurse will then likely call you back to a private room to take your vitals, which usually includes your height, weight, and blood pressure. This is standard procedure for any doctor's visit. Step 2. The conversation, the most important part. Before any physical exam begins, you'll sit down and talk with the gynecologist or a nurse practitioner, physician assistant. This conversation is the foundation of your care. Be prepared to answer questions honestly. Your answers are confidential and help the doctor provide the best possible care for you. Common topics include your menstrual cycle. When was your last period? Are your cycles regular? How long do they last? Do you experience heavy bleeding or severe cramps? Sexual health. Are you sexually active? If so, with men, women, or both. How many partners do you have? Do you use protection to prevent STIs? What about birth control? Do you have any pain or bleeding with sex? Medical history? Do you have any other medical conditions? Have you had any surgeries? Are you taking any medications? Do you smoke or use other substances? Symptoms and concerns. This is your time to bring up anything that's been on your mind, such as unusual discharge, itching, pelvic pain, or any of the questions from the list you made. A note on confidentiality. If you are a minor, you might be worried about your parents finding out what you discuss. Laws about patient confidentiality for minors vary by state, but in most cases, doctors can provide confidential care for sensitive services like contraception and STI testing. You have the right to ask the doctor to speak with you alone, without a parent in the room. Don't be afraid to ask, "Is what we talk about confidential?" Step 3. The physical exam. For a first visit, especially for teenagers, a full pelvic exam isn't always necessary unless you have specific problems like pain or abnormal bleeding. Often, the first visit is just a conversation. However, if an exam is needed, here's what it typically involves. The doctor will leave the room to allow you to undress from the waist down, or completely, and put on a paper or cloth gown. You'll be given a sheet to cover yourself with. You can wear your socks to keep your feet warm. If you feel more comfortable, you can ask for a friend, family member, or a female nurse, a chaperone, to be in the room with you. The breast exam. The doctor will first perform a clinical breast exam. You'll lie back while the doctor gently presses on your breast tissue with their fingertips, checking each breast and underarm area for any lumps, bumps, or irregularities. This is painless, and a great opportunity to ask the doctor to show you how to do a self-exam at home. The pelvic exam. This is the part most people are nervous about, but it's usually very quick, often lasting only 3 to 5 minutes. You'll be asked to lie back on the exam table and place your feet in supports called stirrups. You'll then slide your hips down to the end of the table. Relaxation is key. It might feel awkward, but try to relax your muscles. Take slow, deep breaths. Tensing your abdominal and vaginal muscles can make the exam more uncomfortable. The drape sheet will cover your stomach and knees, so you won't feel completely exposed. The doctor will talk you through each step. The external exam. The doctor will first look at the outside of your genitals, the vulva, to check for any signs of redness, irritation, cysts, or warts. The speculum exam. Next, the doctor will gently insert a lubricated instrument called a speculum into your vagina. The speculum is usually made of metal or plastic and looks a bit like a duck's bill. The doctor will open it slightly to separate the vaginal walls, allowing them to see your cervix, the opening to the uterus. You'll feel some pressure, but it shouldn't be painful. If you feel pain, tell your doctor immediately. During this part, the doctor may perform a pap smear by using a tiny brush to collect a sample of cells from your cervix. They might also take a swab to test for STIs. The bimanual exam. After removing the speculum, the doctor will insert 1 or 2 gloved, lubricated fingers into your vagina while gently pressing on your lower abdomen with their other hand. This allows them to feel the size, shape, and position of your uterus and ovaries, checking for any tenderness or masses. Part 3. After the exam. You did it. The exam is over. Here's what happens next. Getting dressed and final questions. The doctor will leave the room so you can get dressed. Once you're ready, they'll come back in to discuss their initial findings and ask if you have any last-minute questions. They might provide prescriptions, suggest lifestyle changes, or give you informational pamphlets. A little spotting is normal. It's not uncommon to experience a small amount of spotting or light bleeding after a pelvic exam, especially if a pap smear was done. The cervix is sensitive and can be easily irritated. It's a good idea to bring a panty liner with you just in case. This should resolve within a day. Following up for results. You'll need to ask how you will receive the results of any tests. Most lab results, like a pap smear or STI tests, take anywhere from a few days to 2 weeks. The office might call you, send a letter, or release the results through a secure online patient portal. An instant urine pregnancy test result is usually available by the end of your visit. Make sure you know the plan for follow-up before you leave. Your first gyno visit, final takeaways. It's okay to be nervous. Your feelings are valid, but preparation can ease your anxiety. Honesty is essential. Your doctor needs accurate information to help you. You are in control. You can ask questions, say stop if you feel pain, and request a chaperone. This is an act of self-care. You are taking a proactive step for your long-term health and well-being. Pat yourself on the back. Please like, share, and subscribe for How to Do Anything.